So in 1999, when I was working on my master's in behavior analysis, I was working on the treatment of trichotillomania. That's people who pull their hair out. And one of the interesting things that I was running into is we had this nice behavioral procedure, but people wouldn't do it. They were like, I don't want to do it. It's too hard. This urge to hair pull is too high while I'm waiting. And they're sort of complaining about all this sort of internal stuff. And I went to my advisor at the time and I said exactly this stuff is happening. And he said, you know what you should learn? He said, you should learn acceptance and commitment therapy. And the interesting thing is I'd always really liked Steve Hayes because he's quite a good theoretician. And I'd always followed that work, but I didn't really know a lot about acceptance and commitment therapy. So my master's advisor and I flew out to Reno, this is 1999, and we took our first training in ACT. And I came back and I integrated acceptance and commitment therapy with behavior therapy for trichotillomania. And that was sort of my first time of realizing how like these really cool procedures that we use to help people change their behavior could really be bolstered by getting these inner experiences out of the way. Like I hadn't seen anything, I know I was young, but I hadn't seen anything that interesting. Now, one of the advantages of doing an ACT study in approximately, 2001, 2002 is that it was kind of novel. So having completed that project, that got me into my PhD with Steve Hayes, who's probably most known for the development of ACT. So Steve and I really overlapped well and had lots of nice, conversations and did lots of nice projects and lots of nice writing where we, integrated these ACT concepts with exposure therapy across all these different anxiety disorders. And, sort of ever since that time with him, I've just kind of been continuing that work in I think a sort of methodical way. Like I'm probably as much of a scientist as I am a clinician. And I've just always been really interested in the way that the things that the client learns while doing an exposure exercise, how that relates to this idea of psychological flexibility. And then honestly, as time's gone on, I've started to see that like they're all an integrated thing. And that idea right there of like the integration of exposure therapy with traditional ACT has kind of been the focus of all my work. I've been at Utah State University since 2007, and this is what I've been doing with my lab. The majority of our studies are on this topic. We've done lots and lots of projects on it. And now in addition, I run an anxiety clinic, and everyone just does ACT-based exposure therapy for anxiety clients. And then somewhat more recently, I've started running my own private practice, and that's a place where I get to practice these techniques. So I've been at this work for quite a long time, whether it be seeing my own clients, teaching students, writing papers on it, running studies. And I'm really excited to show you the work that I've been up to. And I hope that you can take something away from it and do something good for your clients. ACT-based exposures are a chance to practice building psychological flexibility with real-life situations or practicing with real things. Now, the real thing that you're going to choose has to have some meaning to the client. Like it's either tied to a client's value because the activity is actually something the client cares about, or you just have to do that verbally by connecting it some other way. So like here would be a clear example. If your client had a social phobia and being able to go out and do things was meaningful to this client, then you could leave the therapy room and go meet people outside of the office or walk into a local store and practice talking to people. And that would be like clearly linked to a value. But then there's other cases where it's less so. So take an example of a mom with OCD, who's afraid she might harm her kid. We could practice in the room having things that she could use to harm someone, like a knife or something like that. And she could practice having that around. And while that's not actually tied to her value of being a good mom, being able to practice with the therapist is going to make it easier when she gets in the kitchen and she's, cooking something and the knife's giving her discomfort. So again, I'd want to tie the work to a value, but then the other thing that's really important to me when doing an ACT-based exposure is that we're building one of the other processes too. So that could be acceptance, diffusion, being present, something like that. Now, what I usually do is when the client comes into session, kind of based on, whatever assessment I'm using, I think about what process I want to build. So I'll work on that a little bit at the beginning of session. So like, let's say it's acceptance. We might talk about the client's struggle with avoidance and acceptance, kind of build that up, maybe do an acceptance metaphor, and then say, okay, I want to take that skill and let's go practice it in a real situation. In designing the exposure, you'd want the client to really be in touch with building psychological flexibility, whether you're really focusing on like acceptance or diffusion, and to not be focusing on how much anxiety is produced during the session. Now, like I said, I might check in sometimes to see if anxiety is being built or if there's some, sort of fear that's happening, but I'm not looking for the habituation model, right? I'm not looking for it to be nice and high and then to drop. I just want the client to be in sort of a difficult values-based context where they can practice acceptance or diffusion with something that's real so they can get better at building their psychological flexibility. So if I had to think about defining an ACT-based exposure, it's really an opportunity to practice interacting with stimuli that are difficult for the client, that are somehow related to their values, but then also let them build psychological flexibility. It's just like a real life situation to help build psychological flexibility. Now let me give you a couple examples. So we have a client who is fearful of contracting an illness, and I think when I talk about the core fear, her core fear is like ending up in a hospital and dying. So it's not giving it to someone else, it's actually what it would be for her, to catch it. So she avoids anything that she's not totally sure it's safe. So things like fruit are really hard because they were sitting out and people could have touched them. Yogurt and kombucha were also things that were sort of difficult for her, right? So what we did is we bought kombucha because it's something that's, sort of growing. And her and the therapist each, poured a little cup and they practiced drinking it. But before they drank it, the therapist said something like, what would you get out of doing this work? And she's like, well, I could go do things with my friends. Like restaurants are super hard for me because I don't know who touched the food or what they did with it. So like if I could handle this, I could maybe handle a restaurant. And then my therapist said, okay, well, like while you're going to drink it, notice what your mind is saying and like try to think of that chatter like, people in the stands at a sporting event yelling things at you. Like it's not stuff you have to listen to. And as you feel that feeling of disgust, just ride that wave, right? We're just gonna like we're gonna stand there and let that feeling wash over you. And we're gonna practice feeling like that, right? And they drank kombucha together. So like another panic disorder example, this was a client that I had. He had an interesting thing where he felt like the wind would take his breath away, and that would lead to these panic sensations. And he always carried his Ativan in his pocket, to control the panic attack. So what we did is we took the Ativan out, put it on my desk, and then we walked out to the soccer field that was near my office, and we practiced being out there in the wind. And now, and while we were out there, or maybe before we left, I said, what's meaningful about an activity like this? And he's like, well, if I could do this, right, then I can go places with my friends. I could go play basketball with them. I could, travel without having my Ativan with me all the time. And while we were out there, right, so there was the value. And while we were out there, I coached him on things like, notice your body for anything that you're doing where you're blocking the wind from hitting you. Like, why don't we even get our lips in a way that the wind comes across it? Like, let's really get that feeling of it taking your breath away, right? And that was me kind of coaching acceptance and values in the middle of an opportunity, right, for him to do an interoceptive exposure. So one of the things I do want to remind you about is tying the exercises to the core thing that the client is struggling with. Like, it has to match in sort of a meaningful way. So like if we took a generalized anxiety disorder issue and someone I know struggles with, planning things out for her family perfectly. So she might spend 20, 30 hours, like picking out the right flights and the right hotel so that everything goes super well for the family and everyone's happy and no time was wasted. So a good exercise for her could be, we're going to make a decision, but we're going to lock in a time frame. And that for her, like decisions that affect the family would be really powerful because, that's her fear, that she's going to do something sort of suboptimal and the family isn't as happy or doesn't, have as good a time. So I might say, how about this? Like, you go on a vacation to Florida and, you can plan something for 3 of the days, but the other 3 of the days you don't get to plan anything. Like, you just have to pick it out when you're there. To a handful of people listening, they're like, oh, that's how I vacation, or that's like very normal. But for someone with a worry problem, if you don't have a plan, the time could be wasted. So that would make for a great exercise. But then the other thing that I'd want, and this would go across all the things I've talked about, is once you've made that decision, like I'm not planning those days, you have to practice being in that discomfort. Like, you have to practice being there with, not knowing what's going to happen next and not engaging in sort of like things to control that feeling. Like, it's kind of like the kombucha. After the person drinks it, I don't want them Googling how long till you get sick, or, how safe is kombucha, or, once you've made that step, now we get to keep practicing being there, with whatever comes up.